So I'm just going to take 10 minutes. I've chopped the presentation down because I'm the only person on this lineup who can't be offended by my asking them to reduce the size of theirs. Just a roundup, really, of what we've done since we last saw you at our conference in Leeds last January, and what we've got planned coming up over the next year. So in the last 12 months, we published the 17-18 core annual report. I hope you read it. The parent summaries are being posted out to you very soon. So if you haven't read the main report, you can read the nice, friendly, small one. We've submitted the 18-19 report to our funders. It's being reviewed, and that will likely be published in March, which is when all the 18-19 data will be made public. Your unit level summaries will go out in about a fortnight, I believe. Justin's getting his to review just to make sure there's no glitches in it on Tuesday. So hopefully some good news for many of you in those. In fact, I have seen the results. I know there's good news for many of you in there, which is fantastic. We published the Spotlight audit reports, and we presented on those at ISPAD in Boston, which was an incredible experience. I've always thought it would be quite a decadent use of our budget to go, and I always thought it would be okay for Justin to go or our board members to go and feed back. But actually, it was so inspiring seeing the impact of, or the potential impact of our data from this country. I hadn't quite realised how lucky we are to have a national data set. And after our presentations, I presented with Megan, who you heard from earlier on the quality programme. We had people coming up to us from Canada, from North America, just asking how we've done it and just wishing that they had a similar data set. So that was really inspiring and very motivating to do more and to share our data more. We haven't really published too much from the project, and I think we need to, because these successes need to be shared internationally as much as possible. As I said, the PREM surveys collected nearly 14,000 responses, which is amazing. Thank you so much. I know that was a lot of effort at unit level, and we're really grateful for that. It's going to be a brilliant report, and we'd like to take that to ISPAD next year because we're so far ahead in terms of our PREMs. I don't think a single other country has done a national PREM, so it's really important that we shout our findings from the rafters. Those of you who came to our Leeds meeting would have seen David Mars, who is at Stanford and is president of ISPAD. And he came to our conference, he did the keynote, and he was really impressed by the continuing improvements in HbA1c that we're seeing over here. And they're not seeing that in the type 1 diabetes exchange that he runs in the US. So he suggested that we collaborate on a paper with some researchers in Germany and get their registry involved, just to do another international comparison looking at longitudinal HbA1c outcomes, because we're doing really well, and he knew that he could use that data, our data, to lobby for improvements in care in America. So your work is having an impact here and also abroad, and that's really important to remember. We got some new team members. Karina Green, wave, is our, well, not so new coordinator anymore, but we're so delighted to have her. She's an absolute superstar. Where's Saira? Saira is our new analyst, joins us from the University of Havana in Cuba, and is an I can never say this word, econometrician by background, which is fantastic because she's got a completely different idea of what we can be doing with the results. And I'm really looking forward to showing you some of the new graphs that she's come up with and new analyses in the next national report. And Simon, new administrator Simon, is he here? I think he's clearing up outside. Well, it's great to have Simon. And it's still nice to have Tom. He's not quite so new. And we've also completed a contract extension process, which I'll explain a little bit more on this side. So the NPDA is commissioned by HQIP as part of NHS England's INCAPOT programme, and I can't remember that acronym, but there's about 40 audits that you'll see in your trust quality accounts, and we're one of those. And so every 3 or 4 years, we wait to see if our disease area has been prioritised for attention and funding. And fortunately, diabetes is prioritised, or has been prioritised thus far. I suspect it will be for a while. We won the competitive tender in 2017, and we're coming to the end of our contract. So we've been invited to bid for an additional 2 years of our contract in its current phase before we go out to competitive retender and try and convince our funders that we should run it again. So Justin's already shared some feedback that we got from Jackie Cornish, which you can see again on my slide. We were so delighted to receive that feedback. I printed it out and I put it on our wall because it's just so incredibly motivated. But I wanted to share it with you, just because I want you to see how much we get as a team to bask in your reflected glory. So the top speech bubble, that was the first comment on our application for a contract extension. We put together our proposal, and the top line was, "The project has performed extremely well since 2011 with a programme of incremental improvements, quality improvement initiatives, and demonstrable improvements in management of paediatric diabetes." Just really want to hammer the point home, if it hasn't been made enough already today, that what you have been doing in your clinics is recognised nationally. Our report goes straight to the desk of the NHS Chief Executive, and your achievements are recognised and known. And we love basking in the reflected glory. They think we're a great audit, and they think we're a great audit because you're showing results. Although I will take credit for the succinct summary and quality of presentation. So we've defended our proposals in a meeting. We're just waiting for the signed extension to contract. And as part of the contract extension process, we were asked what we wanted to do over those 2 years, and we had 2 main ideas. One, building on the work of the Type 2 subgroup, the working group of the national network, we thought it would be a good idea to do a wider spotlight on the care, treatment and outcomes of children and young people with type 2 diabetes, because as you probably noticed, the numbers of children and young people with type 2 diabetes are increasing in paediatric diabetes units year on year, but they're still small numbers in most clinics, which makes it really difficult for many teams to build up the confidence and expertise to know exactly what to do to optimise the treatment and management of these young people. So the subgroup of the national network has been doing fantastic work to develop guidelines and to share expertise. And we're going to do a spotlight audit, a state of the nation. Most of you, I think 90 out of our 173 participating units have got fewer than 5 patients, so it shouldn't be, with patients with type 2 diabetes, so it shouldn't be a huge audit burden. It's just going to be an online questionnaire, which will roll out at some point in year 1, at the end of year 1. And we wanted to work with the NDA to establish a reliable figure for the number of children and young people with type 2 diabetes. In our audit, we've got approaching 800. The NDA, or Diabetes UK, published their data last year suggesting there were 7,000 up to the age of 25, and we just want to be sure about that and work with their statisticians. Is there anyone from the NDA here today? Hello. Yes, we'll be working with you to establish a protocol for working out exactly what's going on there and where these young people are receiving their care, and are they receiving the best care. We'll also be rolling out national PREMs in year 2 at the request of our commissioners, but we won't be conducting a feasibility study into an audit for young adult clinics. We wanted to do that because we've been getting approaches from young adult services who wanted to join the NPDA, and we're not resourced to do that. We've got a paediatric focus. It wasn't quite right. So we thought we would do a feasibility study to see if a young adult audit would be feasible. But HQIP felt, and NHS England, the Welsh Government, felt that that might be duplicative with what the adult audit was doing. So instead, the adult audit, I believe, are going to be doing the granularity of their younger adult data will be improved so that it's better able to be used for quality improvement initiatives. So over the next 12 months, we're going to publish the 18-19 core report. And we're going to implement some updates to our data capture system based on some of your feedback from the last round of data collection. We want to include run charts, and we want to make it as useful as possible all the year round so that you can use our data capture system to really support your PDSA cycles and your own initiatives. So we've got to develop the Type 2 Spotlight audit measures, update the data capture system to collect it and commence data collection, work with the NPDA, as I said, to establish a methodology for accurate T2 numbers. And we're going to publish a report on themes from clinic chats with children and young people with type 2 diabetes that are about to start. We found that it's very difficult to get children and young people from deprived backgrounds to come to the kind of workshops that we would traditionally do when we're trying to get the views of young people or families with diabetes. So we commissioned the engagement team at the college to just go to clinic and just find out what the views are of children and young people with type 2 diabetes about their condition as well as their care. But what does it mean? What does it feel like to have this rare, at this age, form of the disease, and why we're seeing lower numbers of health checks completed for this health group. It seems that they're a difficult group to engage, and we want to understand what's behind that so that interventions can be targeted. And as I said, we'd really like to present our PREM results at ISPAD and publish at least one article in a high-impact journal, which is outside the deliverables of our contract, but if I say it here, we'll probably hold ourselves to it a little bit better. So hopefully next year I'll be able to tell you that we did. Have we run to time? Are we okay? Have we got time for any questions? 2 minutes over. Oh, okay. Well, in that case, you call us anytime. We're in the office, 9 to 5. Send us an email, or immediately after the conference, we're going to be at the Mason's Arms on Devonshire Street, which is just over there. So please feel free to join us if you've got a later train.